why you shouldn't adjust your family, your friends, or anybody if you are not a trained doctor of chiropractic. Okay, in this video, I'm gonna explain you why, and we're gonna let the legal side out of this. We're gonna talk about the human and the professional side of why you shouldn't adjust somebody if you are not trained as a doctor of chiropractic or as a doctor of osteopathic medicine. Okay, all right. Here in Canada and the United States, not sure about the training the physical therapy have. No knowledge about that so much, so I'm going to focus on chiropractors and osteopathic doctors, DOs. Okay, 3 reasons. And I'm passionate about this. Okay, so here's the spine. You have the cervical, thoracic, lumbar, pelvis. Okay, if somebody suffering from pain on the cervical spine, on the thoracic spine, on the lumbar spine, on the pelvis, the adjustments are totally different. Why? Because the bones and the positioning of the bones and the facet joints are different. Okay, so the direction of the adjustment of the force, okay, and then it's more speed than force. It gotta be the right one. All right. Okay, this is number 1. And remember, if you are a professional in any field of wellness, fitness, or medical field, we have a responsibility, which is first, do no harm. Okay, if you're not a professional, if you don't practice medicine or personal training or anything like that, or anybody who is in the wellness or fitness or medical field, then definitely you shouldn't be doing that. Okay, so let's gonna give you an example. I'm gonna give you 3 to make this video short. Okay, you see this bone? All right, this bone, this one is moving forward. Okay, this condition is called spondylolisthesis. All right, in this case, this bone moves anteriorly. It's dangerous. It's a really or very significant, important, dangerous situation for the spinal cord, which is the cable of life. You don't want to injure that cable. Okay, then if that bone moves anteriorly, the last thing that you want to do is to push in that bone and put pressure, because you get injured. You can injure someone permanently for life. Okay, then you don't want to do that. So if you don't know, just don't do it. Okay, so in this case, in spondylo, it's 3 levels, 1, 2, and 3, and also could be a fracture right here in this bone, which is the particularis, and then this is more specific. Okay, I'm gonna make videos to talk about that later. Don't push in somebody on the spine if you don't know, especially if you're doing the right direction. Okay. Second, another example. Okay, the person have a hernia. Okay, herniated disc, you see, and you got all this, you got osteophytes, you got all this in here. This spine is really damaged, and then the bone is misaligned into the hernia, and here's someone who doesn't know what it's doing. Boom, pressure into the hernia. Pain is going to be excruciating pain. It's going to be all kind of trouble. The person is going to be, in pain, hurting for a long time. So do no harm. Do no harm. Okay. Number 3, another example, simple, could be that the person just have pain because he fall from the bike, from a horse, have a motor vehicle accident, and there is a compression fracture there. Okay. So compression fracture, the joint unit is compromised. You don't want to put pressure in a compression fracture. Okay, there's many other examples. Okay, more complicated conditions, patient with diabetes, patient with cancer, you got a specific tumor in the bone of the spine or around the spine, people who got osteophyte formation and go into the IBF, okay, the little canal, this one here where the nerve come out. Okay, you want to know what you're doing. Okay, here's the point. Now we're going to talk, and it's going to be really simple. Why we know what to do is because we're going to a college or university for 4 years. The first 2 years, we cover all the medical science, okay? All the medical science, biochem and, physiology, anatomy, cadaver work, we do nutrition, we do endocrinology, we go to the lab and see the microscope, you cover all, microbiome, all the science, okay? Then every doctor here in the United States and Canada cover And the second part of the training, we actually cover all the technique, chiropractic technique, a lot of different chiropractic techniques. Of course, you master the one that you have to cover few, they are mandatory, and then you master the one that you like the most. You have to put a lot of time outside the class, a lot of time outside the class. We go to clubs, we study at nighttime, we make study groups. We cover physio modalities, we take a lot of time too. We cover acupuncture, we cover exercise, nutrition. We got that complete knowledge and a lot of motion palpation to understand the spine, neurology, neuroscience, and chiropractic techniques. All right. Here's the thing, which is to complete this training, and is one of the most difficult science in medicine, which is radiology. We start with physics, all the physics related to radiology, which is really, it's not fun. Then we learn how to take all the different X-ray, which is the easy part, and then we really study deep all the pathology, all the soft tissue, which is the organs, lungs, heart, and all the other organs. And then we go into the pathologies and understand the bone tissue in the radiology. So you have to learn how to do that well as a chiropractor. So because we have all this training, we pass many exams and we pass many boards, then we can go ahead and adjust somebody, okay? So please don't do it. If somebody asks you for, I have pain, I got pain in my back, can you help me? I got pain in my head, can you help me? I think that what you should do would be, the best thing to do would be refer that patient to somebody who understands passion and know the art and the science of the manipulation and the adjustments of the spine. Okay, so this is Dr. Carrazana. I know that you want to be a good professional. I know that you want to be the best professional you can be. So do I. Then that's why, please refer that patient. Again, Dr. Carrazana. I have to tell you, you will never lose with the info and the techniques that Dr. Carrazana use. Have a good day.